The impact of the climate crisis on human health. In recent years, the escalating climate crisis has emerged as a formidable threat not only to our planet but also to human health. The relentless advance of global warming, fueled by human activities, has ushered in a myriad of adverse effects that extend beyond environmental degradation to directly impact our physical and mental well-being. This video delves into the multifaceted ways in which the climate crisis affects humans, with a special focus on bodily and mental repercussions, sleep and anxiety disorders, and other physical implications causing discomfort and illness. Understanding the climate crisis. Global warming facts. The stark reality of global warming has become impossible to ignore. Data from leading scientific organizations worldwide illustrate a disturbing trend of rising temperatures, with the last decade being the hottest on record. This unprecedented warming is attributed to the excessive release of greenhouse gases, such as carbon dioxide and methane, primarily from burning fossil fuels, deforestation, and industrial activities. Constant summer, a new reality. In several regions across the globe, the concept of distinct seasons is becoming a relic of the past. Countries near the equator and in certain temperate zones now experience a perpetual summer with soaring temperatures year-round. This constant exposure to heat not only disrupts ecosystems but also poses significant challenges to human health and lifestyle. Physical health impacts. Heat-related illnesses. The rise in temperatures has led to an increase in heat-related illnesses, such as heat stroke and dehydration. These conditions can be fatal if not promptly addressed, underscoring the importance of understanding and mitigating heat risks, especially among vulnerable populations. Respiratory issues. Air quality has deteriorated due to the climate crisis, exacerbating respiratory problems among individuals with pre-existing conditions like asthma. The increased prevalence of wildfires, a direct consequence of hotter and drier conditions, further compounds air pollution challenges. Spread of infectious diseases. Warmer climates have expanded the habitats of various vectors, such as mosquitoes, enabling the spread of infectious diseases like malaria and dengue fever to new regions. This shift poses a growing health threat to populations previously unexposed to these diseases. Mental health implications. Anxiety and stress disorders. The relentless pace of climate change and its visible impacts can evoke feelings of anxiety, helplessness, and stress. Climate anxiety, a term increasingly used to describe the psychological distress caused by the climate crisis, affects individuals worldwide, prompting a need for greater mental health support and awareness. Impact on sleep. The discomfort and health risks associated with higher temperatures also disrupt sleep patterns. Heat waves can make it difficult to fall and stay asleep, leading to sleep deprivation and its associated health risks, including impaired cognitive function and increased susceptibility to illness. The psychological toll of constant summer. Living in regions with unrelenting heat can exacerbate stress and mental health issues. The lack of seasonal variation can affect mood and well-being, highlighting the need for adaptive strategies to cope with the changing climate. Vulnerable populations and regions. Countries with constant summer weather. Nations experiencing year-round summer-like conditions are at the forefront of the climate crisis. These countries face unique challenges in adapting to the relentless heat, requiring targeted interventions to protect public health and ensure sustainable living conditions. High-risk groups. Children, the elderly, and individuals with pre-existing health conditions are particularly vulnerable to the adverse effects of the climate crisis. Ensuring these groups have access to adequate health care and support is crucial in mitigating the health impacts of global warming. Governments and communities must implement policies and initiatives aimed at reducing greenhouse gas emissions, improving air quality, and enhancing public health infrastructure. From investing in renewable energy to promoting public transportation, a multitude of strategies can help address the climate crisis. The climate crisis poses a multifaceted threat to human health, with far-reaching implications for our physical and mental well-being. Understanding and addressing these impacts requires a concerted effort from individuals, communities, and governments worldwide. By adopting sustainable practices and advocating for policy change, we can mitigate the effects of global warming and safeguard our health and the planet for future generations.